Happy Wednesday, happy Car Crash Wednesday to all of our viewers on LinkedIn Live or on YouTube catching this on the replay. I would be remiss if I didn't introduce my partner and colleague and physician legal consultants, Dr. Armin Feldman.
Hello, welcome everybody. I think we have a great case to go over with you today, something common and something unusual.
Yeah, and I want to apologize. My lighting is usually a little bit better today, but here in Pittsburgh, the sun is shining and we're in February. And so I'm not going to complain too much, but the Armin's in Denver, and I was just telling him before the show started, I'm so jealous of the sunshine that they get.
Right. So, in fact, one of the reasons I moved from the Midwest, from Wisconsin to Colorado, is that we have 300 days of sunshine a year. So enjoy it, Mike.
Awesome. Well, before we start, I'm going to throw up the topic here today. We're going to talk about hernias, a hernia, specific redacted report, headaches and shoulder pain, specifically that occurred after a crash. And the attorney needed us to get involved to amp up negotiation support for this case settlement and provide research about hernia after a traumatic crash. And also, if anyone watching the show today is interested in hearing more about the services we offer, wants to see a redacted report, you can reach out to us at comments@physicianshelpingattorneys.com. You can also go to that same website, physicianshelpingattorneys.com, and listen to our podcast. And we're still recording weekly podcast episodes.
Right. We just dropped episode number 15.
Yeah, and the podcast, we're a little bit more casual. We share a lot of cases, a lot of specifics, and feel free to tune in. But most importantly, certainly reach out. Drop a comment in the LinkedIn message area today, too, if you have any questions about this case or anything else. And we'll be happy to explain how we're helping. The real key to our services are quick turnaround, affordable doctor consulting work, and high-level research with these reports that we call comprehensive medical summary reports.
Right. And I'd throw one other thing, years of experience at doing this. This is a relatively new field, this medical legal consulting, but Mike and I can share our years of experience as well.
Well, you have more than I do. You have 15, and I'm just over 3. So it's pretty awesome. Congratulations. So jumping into today's case, this occurred a little while ago, and back in 2020, this is fully redacted. And this woman in her 50s or 60s was in a car crash. The vehicle was coming in the other direction, so it was a head-on collision. They thought that the vehicle was going about 30 or 40 miles per hour, and she struck her chest on the steering wheel. Didn't lose consciousness, may have hit her head, isn't really sure, and all happened really quickly, must have been absolutely traumatic. And she presented that from the crash with chest pressure and right lower leg pain with bruising.
You know, Mike, I would say one thing too. I mean, we're not structural engineers or physicists, but if she struck her chest on the steering wheel, that must have been before the airbag deployed. So that accident must have happened with a tremendous amount of force, and that's pertinent to the case.
It is. So then the following day, she went to the emergency room and back with neck pain, headache, and left hand pain. The doctor in the emergency room also noted that she had difficulty concentrating and that her headache is likely secondary to concussive symptoms. I did this phone interview, and I can share with you that she's a proud woman. She is not someone who seeks routine medical care. She doesn't want to be sick. She doesn't view herself as a victim.
And she's a hard worker.
She is a hard worker. She was working 3 jobs before this crash. And so 4 days later, she goes back to the same emergency room with abdominal pain. And who knows if they had been there all along or not. She was just so flustered from this crash. They do an exam, say that she's having chest pain, and now this CT scan of her abdomen shows a very large paraesophageal hiatal hernia. That's where the stomach, a lot of people might not know this, lay people, but your diaphragm, which are the muscle in your chest that moves your lungs up and down, there's a hole in it where your esophagus goes through and the stomach sits below. A hiatal hernia is where that stomach actually pushes up through that hole in the diaphragm and is now in your chest. And I don't know if I put that in this report or if I highlighted it, but they actually told her entire stomach was in her chest.
Right.
This didn't just happen. I mean, this was from the car crash 4 days prior, but my attorney was getting a lot of pushback on how could a hernia be related to this crash. So she ends up undergoing about a month later, a robotic, minimally invasive repair where it strengthens that valve that I referenced between the esophagus and the stomach.
Can I just jump in? Maybe this is a preview of coming attractions. I don't want to steal your thunder, but when I first thought about this and thought about this case, I thought, well, the force of the accident must have just wrenched the diaphragm and caused the tear. But that isn't actually the case, right? It's the pressure that is caused in the abdominal cavity because of the blow to the chest, the blunt force trauma to the chest, is what actually rips the diaphragm and expands that hole, which allows the stomach and anything else that should stay in the abdominal cavity from going up into the chest.
That's a really good point. And so she then kind of existed after this surgery for 6 months. She didn't do great. She still had a lot of problems. So she saw another general surgeon who accounted for all this and then said, whatever, it wasn't done correctly, maybe it was too difficult a surgery, you're still obviously having all these symptoms. So she had to undergo a second surgery. And even because of this, suffering over those 6 months, she was depressed, losing her hair, she had chipped teeth, all documented as due to poor nutrition in this otherwise previously very healthy woman. And this was all caused from this massive hernia and required surgery. So she also was noted by her PCP as having this constant left shoulder pain that had started up in that same year. And this had not existed at all prior. Also, headaches come up, that she was now having headaches 7 out of 10, constant. And it's in the treating doc notes that was associated with her recent motor vehicle accident. So these reports, the way we structure them, we go through the history of events, and then we discuss all of the client's ongoing medical problems and our opinions as it relates within a reasonable degree of medical certainty as a direct consequence of that crash.
Yeah, obviously, as our attorney viewers know, this section on ongoing medical problems, that's really where we talk about the medical damages that were sustained.
So first and foremost, this attorney needed confirmation that the hernia was in fact caused by the crash. So I was able to find literature that showed that it's called a traumatic diaphragmatic hernia, actually results from blunt injury, and is such in this paper is such as road traffic accidents or falls from height. And the mechanism of injury was described in the paper, where in blunt trauma, the raised pressure within the abdomen causes a tear of the diaphragm. So this was conclusive research supporting the opinion that the crash did in fact lead to all of these complications and surgeries that were initiated because of this large hernia. So, and I just kind of followed up and made that clear at the end of this section that she's undergone 2 major surgeries. She's still reporting that it just doesn't feel right. She has constant pressure and chest pain. And then it was finally my opinion that she's suffering from known sequelae of multiple hiatal hernia repair surgeries, and that these will probably be permanent.
Can I just jump in here for a sec, Mike? You and I were talking before we got on that this woman might benefit from some other surgical procedures because she's having pretty significant, serious symptoms from this hiatal hernia. But at this point, she is absolutely gun shy. And I think this is one of the problems that she now has, is that she's so concerned about undergoing any other kind of surgical procedure that it might psychologically it's precluding her from doing something that actually might be helpful to her, but she's not going to get close to any kind of surgical procedure at this point. And I think that's a problem that's a direct result of everything that happened.
It's really another good point. She's fed up with the medical system and all of it, because and she's going to continue to suffer.
Yeah.
The next problem that I outlined was her headaches. And I had to make this clear because headaches are so vague, Armin, right? I mean, we hear this in almost every crash comprehensive summary that we do. This is exactly what I usually hear. You know, she had a few headaches before the crash, but they were a 2 out of 10, easily managed with Tylenol, and maybe about 2 a month. She's the woman that had some Tylenol in her purse, and that's it. This turned into headaches that are intermittent, bad headaches every day that she rates a 7 out of 10 intensity. She takes Excedrin headache every day and often has to lay down just to cope with her discomfort. And I just had to paint the picture with research that headache is the second most common symptom of whiplash injury, specifically probably cervicogenic headache, which can vary quite significantly and is often confused with migraines or tension types headaches. And just laying this out, that I believed her headaches are post-traumatic cervicogenic headaches, and a direct result of this whiplash injury that she clearly sustained from this very very aggressive crash.
Right, and that was your opinion to a reasonable degree of medical probability.
Yep. Mm-hmm. And then the other thing is her shoulder pain. This had not been addressed at all. She, like I told you, she was not someone who seeked out a lot of medical attention. And she just kind of put up with the fact that she can't reach up over her head anymore. She used to clean. She owned a cleaning business. And she used to clean floors on her hands and knees, she said, the old-fashioned way. But now she can't do that at all because of the pain in her shoulders and her back. She reported that her husband now has to do all of the chores and laundry. She can't even lift light towels up over her head to put them on the shelves. And she used to clean. Her daughter was actually, I should mention, her daughter was on the phone during this interview. And her daughter said that her mom was someone that if she came over to watch her grandchildren, she would get home from maybe a date night and her mom would have cleaned the whole house. It's just the type of person she was. And she's completely changed. She now isn't able to do any chores, and it was a overnight change.
Right. I think this also brings up something else, which is pretty common, and that is obviously people that are injured in accidents, they are preoccupied with whatever is the biggest problem, right? In this case, the symptoms that she had from the hiatal hernia. And what often happens is that means that other very significant problems aren't addressed immediately. So the consequence of that is that something like this shoulder injury, which might be diagnosed as a most likely a rotator cuff tear, shows up late in the so-called late in the medical record. So opposing counsel, opposing attorneys are going to say, "Oh, this isn't accident related. Look, it showed up weeks, months after the crash. So this is something else." No, it happened immediately. It's just that the client, the doctors were preoccupied with, and rightly so, with more immediate problems. So this problem doesn't get addressed till later. And one of our jobs is to make sure that something like this is included as a damage in the case, and explain away this idea that because it shows up late in the medical records, it's not related.
You nailed it. That's right. And I did firmly believe this sounded like it quacked like a duck, looks like a duck, was a rotator cuff injury of sorts, but she hadn't had an MRI or anything, which is really the diagnostic modality of choice for those very subtle injuries. But it sounded like it. She had back pain that I had to mention, and I brought in some papers about persistent pain among older adults discharged home, and how even though maybe there are no broken bones or fractures, low back pain, upper back pain, and neck pain are extremely common, even at 6 months and beyond in older individuals after a crash.
Right.
And it results in functional decline. And there's no doubt. I mean, if you spoke to this woman, Armin, this was one of those extremely sad phone interviews, because she was just, her whole life changed on a dime.
Right. And I think you wrote in the report that her daughter, and this is very common from loved ones, will report that the person's entire personality has changed. Yeah. And that's often due to a head injury. And I think that's the case here, right?
That's the gray area. That's the harder part. And we can't overreach too far, because as you know, in these reports, we're dealing with the medical record and treating doctors. So we're left to connect the dots, but we rarely can create brand new dots. I mean, I can suggest testing or suggest diagnoses, but I'm not doing a physical exam or a full, we're not accepting her as a patient. She's a client of our attorney.
Right.
And in that sense, I addressed cognitive loss because they reported, like you said, she's a different person since the crash. She said she's in a daze, sad, frustrated, depressed more than ever before. And I believe this is probably due to some element of post-concussion syndrome, that I included this review from a psychiatry journal. And the description that they point out of this showing up late fits the situation that this client experienced accurately.
Right. But what we can do is discuss this with our attorney clients, let them know we think there's a misdiagnosis here. Here are the kinds of doctors you want to send your client to. Here's what we're expecting they'll find. You want to make sure they do this test or that test. In this case, cognitive testing and neuropsych testing, and tease this out.
And so it was easy to conclude that within a reasonable degree of medical certainty, due to the crash, she had a traumatic diaphragmatic hernia, whiplash injury to her head and neck, and soft tissue injuries to her left shoulder and back. And then I outlined the future medical care and costs portion with the graph on the next page. She is not going to undergo, she said at this point, she will not undergo additional surgery for her difficulty eating. She feels hopeless, but I do believe she's going to need an EGD every 2 to 3 years to monitor her symptoms. She may change her mind. She should probably be followed by a gastroenterologist. For her left shoulder pain, it's highly suggestive of a rotator cuff disorder. I think it's glaringly obvious that she needs to be evaluated by an orthopedic specialist. She'll probably need an MRI of her shoulder. Could be treated with physical therapy, PRP injections, steroid injections, medication, chiropractic care. These are all options that I see in her future without my crystal ball. Her headaches should be followed by a neurologist specializing in the treatment of headaches. It's probably cervicogenital headaches. And she'll need an individualized treatment plan. And regarding her concussion, I think that she's sustaining like some ongoing cognitive decline from that. I believe she'd benefit from a comprehensive rehabilitation plan after being evaluated by Neuropsych Rehabilitation Institute. And then I go on to estimate the costs of this care. And these are reasonable geographic costs that are not outlandish. And as you know, these injuries add up. And we're not certified life care planners, but we make these estimations with research, and we put it in a tidy chart form for our attorneys to use for their settlement negotiations.
But we are giving our opinions with regard to future medical care and costs to a reasonable degree of medical probability.
Yes. And that's it, Armin.
Yeah. So one other thing that strikes me about this, Mike, is that it's one thing that this case is so instructive of is that in car crashes and automobile accidents, it's more common than not that the clients are suffering from multiple injuries, multiple problems. And oftentimes, the extent of those problems need to be teased out.
Exactly. If anyone wants to discuss the service that we offer, these comprehensive reports, if you would like your own copy of that redacted report, you can email us below at comments@physicianshelpingattorneys.com. Feel free to drop a comment here on the LinkedIn stream, and we'd be happy to talk to you and see if these types of reports could help you and your clients as part of your settlement negotiations, and whatever host of services that a doctor could provide for your firm. We would like to thank you for tuning in to today's episode.
And we really want to help you to increase case value, save attorney time, and do it without breaking the bank.
We're really looking forward to 2024, and so go ahead and click that subscribe button, hit the notification bell so you're notified of any new episodes.
And we look forward to having you on the next episode.